Vasily Kamotsky, the Russian slap contest, ridiculous slap knockouts, and their potential injuries. That's what we're talking about today.
What'd you say?
So normally, I'm talking to you about injuries that have occurred during sports events or other types of physical activities. Today, I'm gonna do something different. I am reacting to the ridiculous Russian slap contest and the potential injuries that may occur from this absurd activity. To be honest, I can't even believe that I have to do a video on this topic. Like, is this really a thing? For real, is this really a thing? Stay tuned to see my discussion of why I think this competition is more insane than Robert Pattinson playing Batman in the upcoming DC film, and the 3 most space and time warping slaps that I have observed while researching this video. Hey everybody, Dr. Chris, orthopedic surgeon and sports medicine physician. Welcome to my channel, your #1 source for information on orthopedic injuries and sports medicine that's easy to understand for everybody. And I do mean everybody, including Uncle Ted.
Hey, it's me! Ha! It's Uncle Ted!
Stick around to the end of the video to see my #1 reason for why you don't want to compete in this slap contest. And if you haven't seen my last video on wrestling botches, be sure to check that out after this video. That being said, subscribe to the channel, hit the notification bell, and let's get on with the freaking topic. I first discovered this topic after one of these videos came up in my YouTube feed. Shout out to YouTuber Penguins0 for posting content on this madness. And curses to Penguin0 for luring me into this YouTube rabbit hole of insanity. After watching the first video on this topic, I found myself watching several other videos on this activity, not even believing that people did this for real. After I watched several of these videos, I realized that people actually took this activity seriously and that this was not just some sort of prank. Ultimately, my doctor brain started thinking about what are the possible medical effects and potential injuries that could result from this activity, particularly when the contestants are knocked out. So at this point, many of you are still probably wondering what the heck I'm talking about.
Okay.
So for those of you who don't know who Vasily Kamotsky is and what the slap contest is about, let me educate you. Vasily the Dumpling Kamotsky is a 28-year-old farmer from Krasnoyarsk in Russia. Did I say that correctly? Krasnoyarsk. He became an internet sensation and a viral meme after he dominated his competition in a local slapping contest and dumpling eating competition hosted by the Siberia Power Show. After cleaning up in his local competition, he was invited to the second all-Russian slapping championship in Moscow in May of 2019. In his appearance during this competition, he again dominated his opponents and was ultimately crowned the slapping champion. In that contest, he knocked out 2 of the competing slappers on his way to victory. So why are we talking about Vasily Kamotsky and the slapping championship? After watching several of these videos and the sheer level of unusual violence that was perpetrated, I started to wonder about what are the potential injuries that this type of competition might cause. Here are my thoughts on the slapping championship and the injuries that might occur as a result of being a contestant in this crazy competition. By the way, if you want to know more about my life as an orthopedic surgeon, you can follow me on Instagram or Twitter @StableKnees. I'm also on TikTok, Dr. Chris Raynor. So before I talk about the injuries, we need to first talk about the rules of the competition. Yes, there are rules. After all, this is a contest between skilled athletes, not some kind of disorganized sideshow curiosity between intoxicated cretins. For these contests, there are referees to ensure that the rules are adhered to. And there are smelling salts to revive contestants should their consciousness be knocked into oblivion. The basic rules are as follows. Contestants stand facing each other across a small counter-height table. The contestants take turns slapping each other in the face with an open palm. The contestant performing the slap is allowed to take a maximum of 3 practice swings before performing the actual slap. And this is generally seen as good form to allow the contestant receiving the slap to prepare. The contestant performing the slap is allowed to strike his opponent on the side of the face at the level of the cheek. He is not allowed to strike his opponent in the neck, over the ear, in the temple, or at the level of the hairline. Once the swing has been initiated, it should be carried through to completion. No psychs. The slapping contestant must keep both feet, on the ground while performing the slap. The contestant receiving the slap must stand in a stationary position looking straight ahead to allow the slapping contestant a stationary target to strike. The contestant receiving the slap may close his eyes, but he may not move his head in any way until he has received the slap. The contest continues with each contestant taking turns until one opponent is knocked out or withdraws after questioning his life's choices and coming to his senses. And did I mention that they use chalk to better prepare their hands, for like a better slap with more power? And quite possibly for dramatic effect. Because there is nothing like seeing a cloud of white smoke billowing up after you have smacked an opponent full force in the face. Contestants who make it to the final round and who successfully win the competition can be expected to take home approximately $400 to $500 US, or around 30,000 Russian rubles as their prize winnings. Kamotsky cleaned house with his massive mitts at the national championship to become the national Russian slapping champion in May 2019. He held on to this title until December of 2019, at which time he was unceremoniously dethroned. In fact, at the December competition, he was slapped unconscious, face planting on a metal barrel before being taken to a nearby hospital for assessment and subsequent care. However, his defeat was not without controversy, as the contestant who delivered the massive blow did not do so with both of his feet firmly planted on the ground. After watching the match that resulted in Vasily's brief hospitalization, I started to take this sideshow carnival a bit more seriously and began to wonder about what kind of injuries might be possible. It's only an open hand slap, right? Remember that I want to teach everybody about orthopedics and sports medicine. Help me to accomplish this task by sharing this video with everyone who you think might be interested in the topic. Stick around to the end of the video to see my favorite comments from the last video and to see the 3 most ridiculous slaps that I observed while researching this video. So what kind of injuries can we expect from this type of contest? Number 1, abrasions. Although the slap is performed with an open hand, it is possible that the slapping contestant may have calluses on his hand, or that his nails may be sufficiently long to cause an injury to the skin on the face of the contestant receiving the slap. If the slapped contestant is lucky, then this will only cause a minor scratch or an abrasion on the skin of the face. However, if luck is not with them, then this may also cause a laceration. Number 2, lacerations. With contestants taking a full wind-up in order to perform the most powerful slap possible, their hand will be approaching the slappee's face, yes, I think that's a word, the slappee's face with high velocity. It is possible for untrimmed nails with sharp edges to catch on the skin and subsequently cause rather serious lacerations to the facial skin that are exacerbated by the speed of impact and the power of the slap being performed. Not to mention that if this occurs later during the contest, that the skin on the area of contact may already be traumatized and thereby rendered more susceptible to injury. Number 3, contusions. Whether contestants are struck once or multiple times by an opponent, these blows are going to leave a mark. In other words, the face is likely to have a contusion or a bruise on the skin as a result of these blows. The impact will cause the rupture of small blood vessels near the surface of the skin, which will subsequently bleed underneath the skin, causing redness and/or bruising. If the blows are hard enough or of sufficient quantity, even the muscle underneath the skin may also be injured, resulting in additional bleeding and possibly the formation of a hematoma or a significant contusion. Number 4, corneal injuries. While many contestants seem to keep their eyes open during the contest, this is not an absolute requirement of the rules. Consequently, it is possible that an errant slap might not strike the intended area, but rather might impact the slapped contestant, the slappee, in the area of the eyes when they are still open. This could result in an abrasion, or in other words, a superficial scratch, or if more severe, a laceration, a cut, to the cornea, the covering of the eyeball. These injuries are quite painful and irritating, and are likely to require immediate medical treatment to avoid severe vision loss. In some severe cases, these injuries may result in full thickness, meaning all the way through, laceration to the cornea, causing a ruptured globe. You know, like leaking eyeball. Number 5, ruptures of the eardrum. Several contestants can be seen to be wearing earplugs made of cotton batting during the competition. This is a precautionary measure to avoid injury to their eardrums. The speed of the slapping contestant's hand can cause air in front of their approaching hand to be compressed. At the moment of impact, this compressed air, if in front of the ear, will direct the compressed air into the ear canal towards the eardrum. As the hand closes down on the ear, this momentarily seals the ear canal and prevents any of the compressed air from escaping. This compressed air is forced towards the relatively thin membrane of the eardrum. If the slap is performed with enough speed and force directly over the surface of the ear, this compressed air could result in perforation or rupture of the eardrum, as has been reported in the scientific literature. Like somebody actually studied this. Yes, and documented it. This may result in temporary hearing loss. What was that? However, if the speed of the blow were fast enough, or the force of the blow severe enough, then resulting damage could result in even permanent hearing loss. What were you saying? Did you say something? The perforated eardrum could also increase one's susceptibility to inner ear infections. And this just means that the hole in the eardrum would provide an excellent source of entry for bacteria into your inner ear. Number 6, dislocations of the jaw. The jaw is connected to the face at 2 locations, one on either side, the temporomandibular joints. Acute facial trauma, such as from punches or from Dominique Wilkins' windmill-style facial slaps, is one of the most common causes of dislocations of the jaw. You know, like when your mother said she was gonna slap your jaw right out of your head? Yeah, that can actually happen. Overall, however, the likelihood of this type of injury is relatively rare. Depending on the location and the direction of the impact, either posterior, lateral, or superior dislocations may occur. This injury, when present, can be associated with signs and symptoms that include the inability to close the mouth, drooling, difficulty with speech and chewing, severe periauricular pain, or pain around and near the ears, garbled speech, or a palpable preauricular depression, or in other words, a divot in front of your ears. Urgent medical treatment is required to treat the problem. The jaw is reduced into position using any one of a number of techniques. In severe cases, such as when struck by Vasily Kamotsky, the veritable god of slapping, it is even possible for fractures of the mandible to occur. Obviously, these are serious injuries that require urgent medical attention for operative reduction and stabilization. Number 7, in rare circumstances, even facial fractures are possible, although I anticipate that this would only occur with an errant illegal blow or a blow that occurred with a closed fist. If it occurred, I would expect either Lefort fractures of the maxilla or an orbital fracture around the eye. This type of injury would require open reduction and internal fixation with malleable plates and screws. And this just means that we would make an incision and we would fix the fracture with plates that can be contoured around the bones and fracture fragments that are present. Number 8, in other rare situations, it might be possible to suffer cervical spine injuries as a result of the sudden twisting or lateral bending that accompanies the gargantuan blows that some of these contestants receive. Potential injuries could include facet dislocations or cervical disc injuries, which could result in pain, neurologic dysfunction, or even death if they occurred at the appropriate levels. Acute cervical injuries would require immediate medical attention. And finally, number 9, there is the question of being subjected to repetitive concussive blows to the face and head. Although these blows are with an open hand rather than a closed fist, the hand strikes the face with considerable force and speed. Each impact to the face results in 2 impacts to the brain. Let me explain. First, there is the coup injury, when the side of the head struck bangs the brain on the same side of the impact. Then there is the second injury, or CONTRECOUP injury, that occurs on the opposite side of the impact as the brain bangs into the skull on that side once the skull stops moving. 2 injuries for the price of 1. Talk about bang for your buck. If enough blows are received over time, there is a real possibility of lasting permanent injury to brain cells. Eventually, this could result in chronic traumatic encephalopathy, or boxer's dementia. For this reason, from a medical perspective, trying to make yourself into a bobblehead doll, just not a wise idea. Hey, but why listen to me when these 3 contestants can explain it way better than I can?
Okay.
Now, let's look at my favorite comments from the previous video. If you want to be part of the team that helps with the preparation of videos and the selection of topics, then you can join some of my patrons like Andreas Hufton from Norway by checking out my Patreon page. If you're looking for exercises, workouts, or information on injury prevention, be sure to check out our sister channel on YouTube, Human 2.0. Thanks for watching, and as always, that's been a word from Dr. Chris, not your everyday ortho.
Just a flesh wound.